Hi, everyone. Good morning, good afternoon, and good evening, depending on what time it is where you are right now. I am Dr. Isang, our Senior Advocacy Officer at the Global Parenting Initiative, Department of Social Policy and Intervention, University of Oxford. And it is my absolute delight to welcome you all to the launch of the Global Parenting Initiative, the GPI. I would have loved to give everyone the opportunity to verbally introduce themselves, but that won't be possible as this is a webinar. So yesterday morning, I was still racking my brain trying to come up with an icebreaker that is suitable for a webinar when my lovely colleague Annie Opler came up with the brilliant suggestion of a poll. So I'm going to invite you all to kindly participate in a poll and tell us where you are joining right now, where you are. I can see that Annie has shared the link to the poll in the chat. So please go on, jump on right now and share with us where you are at the moment. And while that is on, I have a few things to share. Firstly, please note that this webinar is being recorded. Secondly, the program for this event can be found in the chat. So if you didn't get a chance to download the program from your email, just look in the chat and you'll see the program. Thirdly, if you have a question at any time, please submit it via the Q&A forum, and we will take it during the Q&A session, which will come later in the webinar. Thank you. Annie, do we have the results of the poll yet? Great. This is so interesting. So I see here, can everyone else see the results? I hope I'm not the only one who's seeing. Can everyone else see?
Yes.
Awesome. So I see we have the highest number of participants from Africa, 42%. Amazing. Asia, 22%. Oh no, before Asia, we have Europe with 29%, then Asia, South America, North America. Amazing. It is fantastic that we have people from virtually everywhere in the world. And I think it just speaks to the fact that the work of the GPI is relevant to people everywhere. So thank you so much for coming. It's really lovely to have you all here. And without further ado, I would like to invite Aaron Lee Morris and Dr. Helena Ditch to give the remarks from our donors. But first, I will briefly introduce them. Aaron Morris is an early childhood program specialist at the LEGO Foundation, overseeing a range of global partnerships focused on utilizing play to support the learning and development of children. We're so pleased that you could join us, Aaron. Thank you for coming. And Dr. Helena Ditch is the head of the Solutions Subprogram of the Prevent Child Sexual Abuse Program at the Oak Foundation. Thank you so much for joining us, Helena. I'm going to hand over to Aaron for his remarks now. Over to you, Aaron.
Thank you so much, Isang. Hi, everyone. Thanks for the introduction. I'm so thrilled to be here, joined by Helena, and to be with all of you today at the launch of the Global Parenting Initiative. It's an epic moment, long in the making, and delighted to be able to share some remarks with you. At the LEGO Foundation, our relationship with this group, or a core part of this group, I should say, started in response to the COVID-19 pandemic, when we were able to provide some funding to some of the rapid response work that the Parenting for Lifelong Health team did in response to the pandemic, to ensure that as many families had access to evidence-based parent support messages in the face of what was a really trying time for families all over the world. Our relationship with that team has grown since then, and a lot of that has evolved into what is now this Global Parenting Initiative. At the core of the LEGO Foundation's funding, yes, we are funding innovative and exciting research around the world in low and middle income countries that's going to tell us a lot and help us learn a lot about human and digital hybrid interventions for parents being integrated into systems around the world, evidence that is needed. But beyond that is, I think, what really gets me so excited about this work, to know that not only are we funding this much needed and innovative research, but that we're also funding the supports around that work, and that this team is so dedicated to building networks, to developing early career researchers, to making connections and supporting learning and advocacy, and building an overarching structure for parenting supports and programs to thrive across the world. It is just something that fills me with so much joy. So I just want to say To the team, congratulations on getting to this moment, this launch. We are so behind you at the LEGO Foundation and so grateful and thrilled to be able to support you in your work. I'll hand it over to Helena now. Thank you.
Thank you, Aaron, and thank you for the lovely introduction. I am truly delighted to be here at this launch, this very exciting and very much needed global parenting initiative. Parenting and caregiving are universal. They touch both biological and social parents around the whole world. At the Oak Foundation, we are very committed to parenting as a way to support safe and nurturing environments so that children can grow and thrive. But we also see parenting as a catalytic intervention. Evidence has demonstrated time and again the positive impacts on parenting, on child development, on mental health, on reducing violence against children and interpersonal violence, improving nutrition outcomes, and the list goes on and on. So to borrow from Lucy Kluver's work, parenting is an accelerator. It's an accelerator that helps move the needle on many critical outcomes for children and families. What I find particularly exciting about the Global Parenting Initiative, it's its commitment to building evidence on parenting with a focus on the Global South by Global South researchers, by creating a consortium of key leaders in their respective countries and nurturing a new generation of researchers to continue to lead the way on this important work. So congratulations to the whole team. It is, as Aaron said, we are totally behind you. We're super excited about what's happening and coming up, and we cannot wait to learn alongside you. So best of luck.
Thank you so much, Aaron and Helena. We're so grateful for your fantastic remarks and of course for the support that you have given and still continue to give. I'm now going to invite Dr. Jamie Lackman to share about the GPI in a brief session entitled Who We Are. Jamie is the lead principal investigator of the Global Parenting Initiative and leads the Evaluate team. He's a senior research and teaching fellow in the Department of Social Policy and Intervention at the University of Oxford and an honorary associate professor at the University of Cape Town. Over to you, Jamie.
Thanks so much, Isang, and thank you, Aaron and Helena, for your lovely remarks to kick us off. I'm super excited that almost a year into the official start, we are ready for the official launch of the Global Parenting Initiative, a project that includes research, innovation, and advocacy to scale evidence-based playful parenting programs in the Global South. And our mission is really ambitious. It's to provide access to free evidence-based playful parenting support to every parent everywhere, so they're equipped with the knowledge and tools to help their children realize their learning potential, and to prevent child sexual abuse and exploitation and family violence. And we're targeting the two main sustainable development goals of quality education and peace and strong institutions and violence prevention, but knowing, especially from the work of a colleague and co-PI, Professor Lucy Kluver and her team, that parenting can accelerate across multiple sustainable development goals. And just as a context, we know that 43% of children under the age of 4 years old and living in low and middle income countries are at risk of not achieving their developmental potential, and that 1 billion children each year experience some form of violence, with many further in families struggling with challenges of parenting. And this has further been exacerbated by the COVID-19 pandemic and resulting economic crisis. So the problem is that we know that in-person parenting programs work. There's more than 50 years and 77 reviews demonstrating robust effects across multiple outcomes. Unfortunately, in-person programs, especially those in the Global South, can only reach thousands of families. And we have examples of this in Tanzania, in Zimbabwe, and South Africa, where tens of thousands of families have benefited from the Parenting for Lifelong Health programs, but they're too expensive and resource intensive to meet that current need of millions. Unfortunately, during COVID, we realized what was really possible to take going from thousands to millions through delivery models that include in-person, digital, or hybrid modalities. And so the problem that we're facing is this lack of affordable evidence-based parenting programs that can be delivered at scale And what is needed is to shift the frontier of cost, reach, and impact. And this is the goals of the Global Parenting Initiative, the scale up of evidence-based playful parenting solutions within systems that includes population level approaches, digital parenting interventions, remote delivery, in-person and group-based programs and home-based programs, and intensive interventions within a system of support that targets those who are most vulnerable and also those for all families. And so the Global Parenting Initiative is focusing on 6 countries. We have 9 core studies and 13 core partners with many, many others that are participating in studies and in different initiatives. I'm really delighted to have this consortium coming together that is grounded in these 6 core principles, that we are building the evidence of impact of digital and hybrid and in-person parenting programs, that these programs are scalable and low cost, can be delivered through systems. All of the things that we are researching are also open source and non-commercial, even the measurements that we use to assess the impact of programs. We focus on adaptive and locally relevant approaches, working closely with communities, parents, and children to design and test interventions. We have a strong commitment to inclusive and equitable partnerships, and we think very strongly about the approach of being playful through the perspective of child and learning through play, and empathetic towards caregivers' experiences and needs. And just a little bit more about equitable partnerships, as Helena mentioned. So 60% of our budget is focused on Global South activities. 75% of our leadership is based in the Global South, and we're supporting more than 60 early career researchers. And predominantly those are coming from Global South institutions. And so we're so excited for this opportunity. And what you're going to hear about from my colleagues is about the core themes that make this Global Parenting Initiative. And the first theme is around evaluation, or evaluate. And this is generating evidence of effectiveness and learning more about how these programs can improve the lives of parents and children. The next theme is around innovation, and this is response digital innovation. Then we have facilitate, which is looking at playful learning exchanges among many different learning groups, and you'll hear from the team around this. And advocacy, policy impact and research uptake. Another theme around generating sustainable systems. And then lastly, accelerating scale up and institutionalization. Now, it might come in different orders, but this makes our playful parenting community grow and thrive. And this is for our utmost vision of reaching 250 million people, families by 2030. And this is something that we won't accomplish by ourselves, but in partnership with other collaborators like the Global Initiative to Support Parents and throughout other partnerships around the world. And we're really delighted and excited for this opportunity to work together to really shift that frontier of what is possible in providing evidence-based playful parenting support to every parent everywhere. I just want to thank all the donors who have supported this work and encourage you to follow us on the many different social media platforms. And I will hand it back to you, Isang. Thank you very much.
Thank you, Jeremy. That was fantastic. And following on from Jeremy's speech, I will invite colleagues to share brief presentations on the 6 core themes of the GPI: evaluate, innovate, advocate, generate, accelerate, and facilitate. To speak on the theme of evaluate, I would like to welcome my colleague, Dr. Inge Valens, who's head of research at the GPI. Inge has extensive experience in research and grant management and has supported several studies on parenting for lifelong health. Take it away, Inge.
Great. Many thanks, Isang, for the introduction, and I'm delighted to be here today to share a little bit more about the exciting and innovative work we are doing under Evaluate. Across our research portfolio, we aim to push forward our understanding of human digital playful parenting programs by addressing the following research objectives. Firstly, to establish the effectiveness and cost effectiveness of remote, digital, media, and blended or hybrid delivery of PLH, and improving a range of child, parent, and family level outcomes. Secondly, to examine how the engagement, effectiveness, and cost effectiveness of the PLH human digital programs vary by population characteristics to understand what works best for whom and at what cost. Thirdly, to examine the mechanisms of change leading to positive outcomes through the programs. And finally, to determine the most optimal delivery models to integrate the PLH package within existing government and community-based systems of delivery. Across our studies, we have a set of shared outcomes listed here, with our core outcomes of interest being playful parenting, learning through play, child and adolescent development, as well as child physical, emotional, and sexual abuse, as well as family violence. The GPI includes 9 core studies led by incredible teams on the ground who are working with local partners as well as governmental and non-governmental partners. We have studies that focus on optimization and effectiveness, as well as those that look at systems testing and implementation. I'll do a brief run through of all of our studies now, starting in South Africa, where we have the parent text optimization and evaluation study. This study will look at parent text embedded within an existing system. It will take the form of a factorial trial to optimize parent text effectiveness, cost effectiveness, and engagement. Next, in Thailand, Myanmar on the border, we have the Parenting on the Border study. This study will test a rapid round approach to strengthening outcomes for families who've been displaced by armed conflict. This study will be divided into 2 parts, the first of which will involve the development and testing of a population level film intervention, and the second part being a trauma-informed adaptation of PLH, testing that amongst those families where we don't see change after the film-based program. Then in Tanzania, we have 2 studies on the go. We have Parent App for Teens, which will be developing and testing an app for caregivers of 10 to 17-year-olds, and the Parent App for the Early Years project, which will be looking at an app for caregivers running from pregnancy through to their children being 9 years of age. Now looking at the studies focusing on systems testing and implementation studies, starting off with our colleagues in Malaysia, who will be working to optimize the effectiveness and scalability of parent chat and parent text within the national education system, with programs being delivered by preschool supervisors. In Thailand, so this is our second team working in the country, they will be examining and supporting the scale-up of PLH within the public health system, looking specifically at implementation at scale, adaptation of PLH digital, a focus on male engagement, cost-benefit analysis, and a social return on investment study. In the Philippines, the team will focus on the scale-up of PLH within the government conditional cash transfer system, and will evaluate the feasibility, accessibility, relevance, and impact of digital hybrid modules within this context. In Uganda, the team who has been testing the Parenting for Respectability program, which is an in-person program, will investigate the transferability of the PLH digital architecture to build similar versions for this intervention. And finally, in South Africa, colleagues will be working to identify the most optimal and cost-effective system of delivering the PLH human digital package within this country. In addition to the 9 core studies, we also have a range of really exciting satellite studies who have have common focus areas to our GPI core studies. And oftentimes these are being led by our incredible group of early career researchers and DPhil students. I won't go through them all in detail, but just to say there'll be more information on the satellite projects as well as the core studies on our GPI website. Across our GPI projects, as Jamie said, we are including open source measures and trying our best to harmonize measures across studies so we can ultimately pool data to learn more across settings. And finally, just to close with our Evaluate core team who works to support our studies on the ground. Thank you very much.
Thank you, Inga, for that brilliant presentation. It's just so exciting to see all the work going on in the GPI. I now invite Dr. David Stern, the GPI Innovate Lead, to give a brief presentation on the theme Innovate. David is the founding director of IDEMS International and the lead technical partner for the development and implementation of PLH digital programs. Over to you, David.
Thank you so much for the introduction. It's a pleasure to be sort of here with everybody and sort of being able to present on the Innovate. I'm sure the slides will appear in just a minute. Here we go. Sorry. At the heart of what we're doing is we're trying to build this sort of ecosystem. We recognize that, and when we started with PLH, we recognized that it wasn't a single intervention that was going to meet the needs of all the different types of users who needed this information. And so we really are building a whole ecosystem of interventions, not a single silver bullet, but a whole range of things which can meet the different needs of different people. And at the heart of the Innovate approach is adaptability. We're building the sort of architecture, the underlying structures that will enable individual interventions to innovate and for those innovations to come back to feed the global community. So we're really needing to have the local partners not just thinking imaginatively, but also looking at their data and learning, as we're seeing from the evaluate. Everything we're building is open source, and we're part of the open community trying to build open solutions which can be reused and reusable within many different contexts. This is a meeting we had recently in Kenya with our team from Pakistan and from Kenya, who are being brought into our work as integral partners to be able to expand the capabilities to be able to bring these innovations across the continents and to all our partners. To really highlight some of the key achievements of the last years, well, it's really 6 months on this, but we've been coming out of our work leading into GPI. We've had the two major sort of starting points being Parent App and Parent Text. Parent Text built on UNICEF's Rapid Pro technologies, but going beyond it and being integrated into other messaging services as well. Whereas Parent App is built as sort of an Android app. It's deliverable as a web app as well. And it's a technology where we're not only building an app for Parent App, but we're building a whole infrastructure which enables us to sort of reuse this for other apps. And to not only reuse it for other apps, but to reimagine how the content is displayed. So what we're seeing here for Parent App is two different skins of the same content, where we're trying to reach different audiences by presenting it in the same content in very functionally different ways. At the heart of the Parent Text initiative, which is delivered through any messaging service through the Rapid Pro systems, is the set of tips which have been sort of formulated from the core content and which are very similar to the way that we presented them within Parent App. And so there's good sort of connection building between these different initiatives and how they're distributed. And where I'd argue that Parent App has been sort of imagining within a context how it reaches different people, Parent Text has been going across context. In South Africa, Jamaica, the Philippines, Malaysia, we've been sort of having these pilots which have been learning about how people interact with the content. And, just to finish, this is just the beginning. We're now at the stage we're going into next year, we're starting to work on a whole range of new apps. And as we've sort of got these multiple skins, we can now imagine redesign for new context within the app context. And Parent Text is being reimagined as a sort of what we call Parent Text 2.0, which is also able to be delivered in many different ways as we recognize that different audiences are wanting to consume it in different ways. And finally, really, as we bring all of this together in coherent ways of actually getting the data out and getting the content in, a whole ecosystem which is coming out and which will go beyond beyond the apps we're creating here. We're looking at partners who are building their own systems and how to integrate and work with them. Thank you very much.
Thank you, David. That was brilliant. I love those lines. This is just the beginning, because I think it tells us that we're onto something really big here. To join me and present on the theme of advocate is my colleague, Dr. Janice Lovey, the GPI Advocacy Officer. Janice is an internal medicine physician and Master of Public Policy graduate from the University of Oxford. Okay, Janice, take it away.
Thank you, Isang. Welcome everyone again. I will briefly share about some of the advocacy work and activities at GPI together with Isang, as she mentioned. So this is the outline of our presentation. I will pause for a few seconds for you to have a look. Our vision as advocates is to ensure that all parents and caregivers who need them have access to quality, evidence-based parenting support interventions by the year 2027. And our mission is to work collaboratively with partners to raise awareness and support for the implementation of parenting programs and build a policy environment that supports the sustained institutionalization of parenting programs. Meet the advocacy team: Isang, Lucy, Janice, Susan, and Lena. Now, I'd like to briefly speak about GISP. GISP stands for the Global Initiative to Support Parents, and it was founded by the WHO, UNICEF, ECDAN, PLH, and the Global Partnership to End Violence Against Children. GISP has presented at several regional convenings, workshops, and webinars. Participants at these events included policymakers, funders, and practitioners. I will now hand over to Isang to continue. Over to you, Isang.
Thank you, Janice. And still following up on GISP, in collaboration with our GISP partners and UNODC, UNHCR, other international organizations and NGOs, we have had 2 parenting in crisis responses this year. The next slide, please. The first of these was the Parenting in Conflict Response, also known as the Ukraine Parenting Project. This involved using evidence from the Parenting for Lifelong Health program to develop and disseminate parenting resources to support families that were affected by the conflict in Ukraine. The resources have reached over 11.6 million people, and we're still disseminating. The next slide, please. We have also had the Parenting in Climate Crisis Response, which involved developing and disseminating resources to support the families affected by the floods in Pakistan. We did this in collaboration with colleagues from Quaid-e-Azam University in Islamabad, Pakistan, and as previously, colleagues from UN agencies and other international organizations and local NGOs. The next slide, please. So one of our partner organizations in the Ukraine response, World Without Orphans, adapted the resources and created in-person support groups for women called Hope Groups. This slide has feedback from a participant in one of the Hope Groups, and I'll pause briefly to allow you to read the text on the slide. The next slide, please. So this slide shows some of the global policy advocacy activities carried out by GPI members. This includes sitting in a panel on parenting and violence prevention at the opening of the UN General Assembly, giving keynote addresses at high-level global conferences, and the country-level launch of Parent App, Parent Text, MAPA Text, and the Thai Positive Parenting Community of Practice. The next slide, please. The team have also had great success in influencing global policy on support for children orphaned from COVID. The Global Reference Group's high-level policy engagement with development leaders influenced the response of the White House COVID-19 response team to COVID-associated orphanhood, as well as Pope Francis's engagement on the death of caregivers, all of which have led to commitments to implement measures to better identify and support orphaned children. I will now hand over to Janice to take us to the end of the advocate presentation.
Thank you, Isang. GPI members have also presented at different conferences, including the International AIDS Conference, SVRI, and the EU SPR. We've been on radio in Nigeria, South Africa, and Pakistan, and have published in several leading journals, including The Lancet and the BMJ. These are some of the advocacy activities that we've been involved in, and we're looking forward to doing even much more in the coming year. Thank you very much.
Thank you,
Sam, back
Janice.
to you.
Thank you, Janice. The next presentation is on the theme of Generate, and our presenter is Laura White, who is a consultant on the Parenting for Lifelong Health social enterprise. Laura has over 10 years of experience in education and social ventures. Over to you, Laura.
Thank you so much, Isang, and it's so wonderful to see you all here today. Thank you for taking the time to hear about our progress, and I'm excited to share about Generate specifically. So first, I'll speak a little bit about Generate's goals and objectives. And this is really centered on establishing Parenting for Lifelong Health as a charitable social enterprise. So the goals of this work is to create an agile organizational infrastructure that has the capacity and expertise to respond to the need for evidence-based parenting support and to grow to meet that need. We're also working to enable scale-up and institutionalization within the government, NGO, and private sectors, and we're facilitating collaboration and capacity building among international, regional, national, and local stakeholders. We're also building a first responder model for humanitarian emergencies and crisis situations to build on the wonderful work that you were just hearing about. And we're working to diversify revenue streams across philanthropy, systems building partnerships, and earned income models, all towards the goal of furthering that mission of ensuring every parent everywhere gets access to evidence-based parenting support, ultimately improving child development outcomes and education outcomes, and reducing violence against children. So by looking at all these goals together and working on them in coordination, we are hoping to push the frontier of what's possible in terms of impact, reach, and affordability. Making sure evidence-based parenting support is reachable, impactful, and affordable is a goal that will persist. And we seek to have Parenting for Lifelong Health be a solutions integrator that partners with different systems to ensure comprehensive, tailored parenting support is available. So these are ambitious goals. I'm excited to share what we really focused on in 2022. Mainly, we looked at two big objectives: establishing a legal structure for this work and exploring income streams. The legal structure had to support the vision of Parenting for Lifelong Health, and it had to make sure that aligned with our core principles. The income streams needed to fuel inclusive global growth of the network's fantastic efforts and all the progress that's been made so far. And this has been led by a core team that's global and brings many different skill sets to the table for this charitable social enterprise across research, social enterprise, legal skills, nonprofit leadership, and particularly it draws from the strengths of the network and the people who've been a part of building this movement for the past 11 years. There's some highlights I'd like to share with you in terms of what we've accomplished this year, as well as some goals that we have on the horizon. In terms of highlighted accomplishments, we were able to establish Parenting for Lifelong Health as a charity in the United Kingdom this year, but critically led by a global team in collaboration with the Global Parenting for Lifelong Health Network. We also gained new and funded partnerships that further and sustain our global impact and start to prove out these earned income ideas that we've been exploring. We also co-led global advocacy efforts by being a co-leader within the Global Initiative to Support Parents. And we started exploring earned income streams through partnerships with the private sector, including partnering with Generali Insurance and their foundation, the Human Safety Net, on exploring the social insurance sector. On the horizon, we're looking to establish an entity in South Africa that really builds on the strengths and opportunities for the existing PLH network. We're supporting centers of excellence by strengthening the organizational capacity of parenting for lifelong health network members around the world. And we're establishing a core global staff team to really power the growth of parenting for lifelong health and achieve our mission. Thank you very much.
Thank you, Laura. That was fantastic. We will now have the presentation on Accelerate, but I just want to remind us, if you have any question, please share them through the Q&A forum and we'll take them later. Now, the Accelerate presentation will be done by the GPI Scale-Up lead, Sarah Thakur. Sarah is a public health specialist who has worked with the Global Partnership to End Violence Against Children and the Violence Prevention Team at the WHO headquarters. The floor is yours, Sarah.
Thank you so much, Isang. Hi, everyone. Welcome to the GPI launch. I'm excited to take you through the Accelerate theme of the GPI project. My name is Sarah Thakur. I am the Global Scale-Up Manager. The team also comprises of Dr. Jamie Lachman, the GPI Principal Investigator, and Jason Chow, who is the Scale-Up Assistant. Our team very closely consults with Management Systems International, MSI, who provides technical guidance on the scale-up process. Scale-up will involve transformation at a systemic level. Our goals and objectives for this theme are to provide technical assistance to governments, NGOs, and the private sector to support the scale-up and institutionalization of PLH human digital programs within existing delivery systems, including local adaptation for integration, training and capacity building, and ongoing M&E of delivery. This includes co-development of deployment strategies, local contextualization and adaptation, IT support and capacity building, and integration of monitoring and evaluation systems. MSI is providing us with targeted support to GPI and PLH country program teams to scale their interventions. This support will primarily involve helping country program teams develop strategies for mobilizing constituencies and resources for achieving scale, and for also embedding components of the PLH programs within national government institutions. The modalities of this support will vary country to country, but some of the main activities are conducting stakeholder or political economy analysis with country program teams to identify key actors whose support will be required for going to scale, working with country program teams to identify the advocacy approach and targets that will be most appropriate for mobilizing support and resources to scale the intervention in specific contexts, and using cost planning tools to identify anticipated costs and funding sources, and transitioning from project-based financing to long-term funding at scale. And also, lastly, establishing a coordinating mechanism across capacity building partners and developing and refining tools to support technical assistance and monitor quality assurance. So these could be tools such as manuals, guides, and digital applications. Here's a very quick example of a scaling up framework developed by MSI that suggests a pathway to scale, with step 1 being developing a scale up plan, the second being establishing the preconditions that are needed to go to scale, and the third to implement the scale up process. We have adapted the 3 steps suggested by MSI to fit the GPI's context. So even though the scale-up pathway would look different for each country and would be based on their particular needs and current standing, some of the basic steps we hope to follow are step 1, which will focus on the co-development of a national strategy or a roadmap or a national action plan to scale in-person, remote, digital, and hybrid parenting support in the country. This is a step that we're currently working on at the moment, and I'll talk a bit more about this in the next slide. Phase 2 will focus on capacity building and system strengthening, infrastructure development and support to the government, policymakers, and other relevant stakeholders. Phase 3 is basically shared learning and the execution of the scale up and uptake plan. So just talking a bit more about step 1, which where we're currently at. This phase commenced with conducting in-depth interviews with country teams to further learn about the current situation. This will then be followed by conducting stakeholder and political economy analyses, which is essentially a stakeholder mapping exercise, as well as learning about the current political environment. After which we shall guide the country team to perform an in-depth scaling assessment, which shall aid in mapping of existing evidence-based parenting interventions, assessing scalability and identifying gaps, including existing reach, coverage, and uptake. This will then be followed by the formation of parenting scale-up consortium with core project partners, after which we plan to conduct real-time scaling labs with these partners through a series of in-person and virtual convenings and workshops. We also plan to support the country team by co-developing financing guidelines to support funding scaling up, as well as developing an advocacy plan very closely and in conjunction with the GPI advocacy team who you just heard from. This shall help us create a national strategy, or the roadmap that I first mentioned, that informs our scale up work in the country. I am excited to share with you the highlights from the Accelerate team from the past year. The GPI team has commenced its partnership with MSI. MSI will be actively supporting the scaling up process in South Africa, Thailand, and the Philippines as of now. We already conducted in-depth interviews with these GPI project leads and country partners on creating a scaling strategy, particularly for their needs. We also conducted preliminary scaling assessments to finalize a work plan and identify critical activities as well as timelines. As for other GPI countries, we are expanding scaling up work to Tanzania, which is supported by a new grant from the Wellspring Foundation through the National Institute for Medical Research, as well as investing in children and the societies and PLH. The GPI team assisted with creating a work plan to support the inception phase of this particular scale up. For Malaysia, we use key activities from MSI Scaling Toolkit to inform our work plan to take the Nuangkase program to scale as part of a new grant proposal we have just submitted to the Human Safety Net.
Sorry, Sarah, can I ask you to wrap up, please, in the next 30 seconds?
Absolutely.
We're over time.
With the Uganda team, we're planning to conduct a knowledge sharing session. And just for our immediate steps, as I mentioned before, we will be conducting these stakeholder and political economy analyses. We'll be hosting in-person real-time scaling labs, which will be traveling in the country with, hosting them as like a one-day intensive. And we'll be creating a global status report to document the reach of existing PLH programs. Thank you so much, everybody.
Thank you, Sarah. I'm sorry that I had to stop because we're over time and we're really trying to keep the time so we can cover all the rich presentations we have lined up today. Our final presentation on the GPI theme is Facilitate, which will be presented by Dr. Godfrey Siu, the GPI Facilitate lead. Godfrey is a behavioral scientist with training in public health and medical anthropology and sociology. He currently works as senior lecturer in the Department of Child Health and Development at Makerere University, Uganda. Over to you, Godfrey.
Thank you very much, Isa, for those kind words of introduction. And hi, everybody. I'm really delighted to be here today and to see all of you. I'm presenting on behalf of the Facilitate team that I'm going to introduce in the next slide. But just to say that we are so excited because the Facilitate team is working on a very critical aspect of the GPI program. And I'd like to ask for the slides to move. Okay, so we are working on a very exciting component of the GPI program, which is to facilitate. And the aim is to create centers of excellence in playful parenting in the Global South with a cohort of leading professorial researchers from and working in resource-limited settings. The aim here is to shift expertise and leadership and power balance from the North, Global North, to the South. We want to do this by addressing 6 major objectives. One is to create relevant communities of practice to enable shared learning among the wider field of implementers, researchers, and policymakers engaged in playful parenting work, child learning, and violence prevention. Secondly, we want to establish online research sharing hubs that are linked, that link research around the global world, community, and serving as open repository for scientific material. As you heard from David, we are a community of open source learning. I want to create capacity for early and mid-career researchers as a way to nurture the current and future generation of local research leadership in child learning and child abuse prevention, especially in the global South. Fourthly, we want to develop regional playful parenting research hubs in Southeast Asia as well as Africa. We are also creating a network of early career researchers, mainly from the global South. And we want to support existing national capacity sharing structures to establish and ensure successful uptake of playful parenting interventions and support research and institutional sustainability. Next slide. Just a quick look at the team. I'll mention their names. Professor Kathy Ward, who is the second on the list. Third is the capacity or community of practice sharing lead, Genevieve, who is with us this afternoon, morning or evening, and the GPI capacity sharing lead, who is yet to be recruited, but that process is currently underway. We have benefited from the expertise and leadership of Dr. Inga Valens, who's been leading research and supporting the Facilitate team. Next slide. Just a few highlights. So far, we have managed to establish early career research network with 57 early career researchers who have been recruited in the global South, mainly. 7 of them are from the rest of the world, but 50 are from the global South. We have been involved in GPI leadership and management, and we hope that these early career researchers will engage in a formal program of training on research methods, publications, and research uptake. We have planned for mentorship from senior GPI researchers across all the themes. And we hope that they will have access to capacity sharing funds to support their work, including attending conferences, training, and field activities. We have established playful learning groups. So far, we have 11 that are cutting through different themes, including active learning spaces to connect on key topics of interest. For instance, we have a learning group on male engagement and gender parenting in humanitarian settings and disability inclusion. We have research in progress sessions that are happening every month. Next slide. And looking over the horizon, looking over the horizon, we are looking forward to an exciting 2023 where we bring together the co-design of a series of playful learning engagements with our early learning careers and putting everything into action. Some of the pictures that you see here are mainly people from Uganda, but we also have our colleague who sits at the GPI headquarters at Oxford.
Can I ask you to wrap up, please? Godfrey?
I have wrapped up. This is the end. Thank you very much, and really exciting.
Thank you. Another fantastic presentation. Thank you, Godfrey. And Godfrey just talked about the Early Career Researchers Network. I'm happy to share that one of the strategies of the GPI is capacity building and supporting early and mid-career researchers. And right now, a few of the early career researchers at the GPI will briefly share about their work. We would like to introduce Janelle C. Reyes from Ateneo de Manila University in the Philippines to give a brief presentation. Jen is the early career researcher lead on the Global Parenting Initiative Executive Team. She's also the principal investigator for the Parenting Within the Social Welfare System study in the Philippines. Over to you, Jen.
Thank you, Isang. So hi, everyone. Good morning, good afternoon, good evening. So I'm Jen Reyes, GPI's project lead in the Philippines. So just a brief background about myself. So currently, I'm a part-time faculty member of the Ateneo de Manila University under the psychology department. As mentioned, I'm also the lead of GPI in the Philippines. I'm the program director of Parenting for Lifelong Health Philippines and a member of the GPI executive team to represent the Southeast Asia region and early career researchers. So I'm also one of the lead trainers of the Masayang Pamilya program here in the Philippines. I started in PLH as a facilitator way back in 2017. So the first photo that you see, the one on top, was during a Masayang Pamilya or Happy Family implementation years ago. Since then, I've worn multiple hats and I've done various roles within the PLH Philippines team. I became a program and content developer, project manager, coordinator, finance person, trainer, and even a layout designer at one point. The second photo was taken last week where I had to represent PLH Philippines in an event hosted by a government agency. And through the years, I've developed immense appreciation to the program and admiration for the PLH team. We're just really a small group here in the Philippines. And now, as the lead of GPI in the Philippines and as an early career researcher, again, I'm wearing different hats with challenging but definitely motivating roles to deliver evidence-based parenting programs for and to Filipino families. Since the start of GPI this year, there has been a number of opportunities to collaborate with international partners and organizations. What I like about those collabs is actually the people from different contexts and countries with the same advocacy working together to share their practices, their challenges, as well as their solutions in implementing and evaluating programs in a real world setting. There's a lot of things to learn from those sessions. And because of this learnings and sharing, slowly, PLH Philippines team is able to build and strengthen the different arms of our team to support and promote evidence-based programs to our local partners. So this is in a form of training, program implementation, evaluation, and advocacy. Recently, through our partnership with UNICEF Philippines, we were invited by the Program Management Bureau of Department of Social Welfare and Development to help in crafting the content and technical input in creating the implementing rules and regulations for a recently passed law, the Republic Act 11908 or Parent Effectiveness Service Program Act, which of course is a huge opportunity for us to advocate positive parenting and data-driven evaluation. On the horizon here in the Philippines, we are looking forward to have more evidence-based parenting programs being implemented in and by government agencies, local government units, and other organizations. In addition, we also aim to create training hubs to capacitate community service providers so we can reach every family and create happy families for Filipino children. Thank you so much for listening.
Thank you, Jen. That was amazing. Next up is Dr. Amalie McCoy from Peace Culture Foundation in Thailand. Amalie has over 20 years of experience in child protection and child rights research, programming, policy advocacy, project design and management, and local capacity building with UN agencies, academia, international NGOs, and local NGOs in the Asian region. The floor is yours, Amalie.
Thank you so much, Isang, and good evening to everyone from Bangkok. I sincerely appreciate having this opportunity to say a few words about being an early career researcher under the Global Parenting Initiative, a role which has been truly an honor to have to date. First, a quick overview about my position within the GPI. I'm the lead and co-principal investigator for the Parenting Within the Public Health System in Thailand project based at the Peace Culture Foundation. Along with Dr. Sombat Tapanya, I lead a team focused on strategic research and partnership building to scale up the PLH Young Children program. This work continues on from critical foundation work that was started in 2018, funded by UNICEF, which allowed us to culturally adapt and evaluate the program. I'm also a regional focal point for the Global Initiative to Support Parents and on the GPI Leadership Forum. In terms of my personal background, I'm Thai American. I've lived in different countries in Southeast and Southeast Asia. And also, though I'm early on in my academic research career, I'm actually a mid-career professional with over 22 years of experience in child protection, child welfare, and child rights. I have experience working at multiple levels, including community, national, and regional levels, with various UN agencies and NGOs. These positions have been as varied as being an international civil servant with UNICEF to working as a regional coordinator on child sexual exploitation for ECPAT, and an independent Fulbright researcher in the Klong Toi slums of Bangkok. I also became somewhat of an unwitting degree collector. Since I've always enjoyed lifelong learning, and so I hold a PhD in social intervention and policy evaluation from Oxford, a related MSc and MAs in child and adolescent welfare, as well as Southeast Asian studies. To date, I found that being a GPI principal investigator has provided a valuable opportunity to continue the foundational work from the first phase of adapting and testing PLH in Thailand. It has also allowed me to converge the experience I had within the international development field with robust academic research. I certainly feel that these two worlds belonging to development agencies and academia should be working much more in sync and learning from each other. I foresee that the GPI will have a very positive impact on my career trajectory by opening possibilities for active knowledge exchange and further research skills building, not just from colleagues in high-income countries and at globally renowned universities, but just as, if not more importantly, from peers in other low and middle income countries. I'm hopeful that this experience will bolster my project management and policy advocacy skills, which I intend to use to help foster Thai and regional networks on the importance of robust evaluations, as well as evidence-based interventions that really do prevent violence against children in the real world. So thank you for listening, and back to you, Isang.
Thank you, Amalie, for that excellent presentation. We also have Dr. Lingiwe Sakolo Gwebu from the University of Cape Town in South Africa, who is the principal investigator for parent text optimization and evaluation in South Africa. Lingiwe is a postdoctoral researcher with the Center for Social Science Research at the University of Cape Town, where she works with a multidisciplinary team on the scale-up of parenting evaluation research study. Take it away, Lingiwe.
Thank you very much, Isang, and thank you very much, everyone, for being here and for joining today. I'm actually excited, thrilled to be sharing part of my journey with you. On this slide, you can see two pictures on my right. So these two pictures are very important to me because of the journey they represent. I'll start with the one below. The one below is a picture that represents a moment as an early career researcher. At this time, I was doing my PhD, almost finishing up, but this was my first international conference. This was in Boston, USA. It was a maternal and child research conference. And immediately after finishing my PhD, my first role after that was within the GPI. And that's why then I put the second picture on top. This picture was recent, actually. It was taken a couple of months ago. This was a picture that was taken in the inaugural hospital. And this was during our field visit. It was our first visit as in my capacity as a co-principal investigator. So from my PhD right to becoming a co-principal investigator, so many landmarks and so much the long journey in between the two, but exciting as well. And during this moment, captured in the first picture, we had an exciting moment in Akonhoek. Akonhoek is in Mpumalanga, and Dintswalo means tangible love, peace, and gratitude. We had an exciting moment. It was my first time leading a team as a co-principal investigator. I'll talk more about that. But this journey actually, I'll give credit to the growth and the inspiration that I got within GPI. Yes, now let's get to what I do. Yes, let's get to what I do. So I'm currently a postdoctoral researcher at the Center of Social Science Research at UCT. I'm also a co-PI, as I stated earlier, under the GPI Parent Text Optimization and Evaluation Study. And this is a role that I took up recently in this year. I'll talk more about that in my next slide. I'm also a PLH regional and focal person for the GPI to support parents in Southern Africa. But also recently, I've been appointed as a senior lecturer in public health department at the University of Fort Hare, an achievement that I also see as something that actually came through the growth and the journey that I've walked through as part of being this, as being a part of this initiative. Looking at my background is basically in community health nursing and midwifery and public health, specifically maternal and child health. My experience basically ranges from being a nurse, working in a clinical setting, but also evolving to a community-based setting where now I work as a health promotion specialist. But then after advancing my career, meaning my master's and PhD, I then took other roles as becoming a lecturer and researcher. And I'm beginning to grow in these roles until this day and hope to grow even further. I worked with community-based organizations, like I said, but my focus mainly was in maternal and child health in adolescents and sexual and reproductive health, which then was a best fit for me after PhD to join the team. So after joining the team, my experience in GPI, I'm going to talk about two major projects that I actually participated in or worked in. And I'm excited to share this because of the linkage between the two projects and how they worked together to provide a thriving environment for my career. First, on my left, you see when I first joined as a postdoctoral researcher, I worked with an amazing team. And the super study basically examines the implementation and scale up of parenting for lifelong health programs across different countries. This was an exciting moment for me, just jumping from my PhD work to this role. I worked with different teams. I worked with partners in over 10 countries. And this actually gave me the skills that I needed and built me for my next role, which is the core PI and research collaboration at global scale. Here I am leading a team, basically implementing all the skills that I learned from my first role. And I feel this is the amazing thing about GPI, just seeing your growth, how it feeds to the other next level of your life. And also in the middle, you can see the building of solid relationship. It was part of my role in the first project, but these are the relationships that I built on that are working for me right now as I work with the team, leading the team, working closely with Jamie Lachman, who is experienced in RCTs, and that also fits into my journey. So lastly, I'm going to talk about how all this—
wrap up. Thank you.
So lastly, I'm just going to talk about how all this has worked together to see the lady on the other side. So basically all this summarizes the experience that I got as a lady that joined the research as a PhD, I mean, soon after PhD, but now ready to take on a role as a senior researcher. So all this basically that you see on this slide summarizes all the input. And I'm so grateful to all the partners and the GPI community for all the work they do. Thank you.
Amazing. First of all, I want to say congratulations on your appointment as senior lecturer, and thank you for the amazing presentation. At this time, I'm going to hand over to Dr. Jamie Lachman to wrap up the sessions. But I want to say this does not mean that the program is over, so please stay on. Right after this, we will have short remarks from our partners, followed by a Q&A session. Jamie, the floor is yours.
Thank you so much, Isang. I mean, all I can say is, wow. You know, when you write a grant proposal and work on for planning a area of work with different people, you never really know how it's going to come to life. And this launch has really brought all the different faces and people from all across the world together. And it's been such a privilege just to sit back and listen to the diverse voices that are making this global parenting initiative reality. I'm not going to say very much more. There's, as you can tell from the presentations, there's a lot of stay tuned. So there will be a lot to look forward to in the future. But I just want to now hand it over to back to you, Isang, and then to our word from our partners, and then to the Q&A, because I think that, you know, the work that we do is very participatory, and we want to be able to maximize the amount of time that is available to those of you who are listening in so that you can participate too. Thanks.
Thank you, Jamie. Okay, for the remarks from our partners, we have a recorded message from two of our fantastic partners at the Global Initiative to Support Parents, Sabine Rakotomalala and Shekufe Zonji. Sabine works in the Violence Prevention Unit within the Department for the Social Determinants of Health at the World Health Organization in Geneva, Switzerland. Her work involves the prevention of violence against children through supporting advocacy, violence prevention initiatives, and networking of key partners from different sectors in the field. Shekufe Zonji is the Global Technical Lead for Early Childhood Development Action Network, where she spearheads skill learning and strategic partnership initiatives for the network. And now we'll hear their remarks.
Hi, everyone. My name is Shakufe from the Early Childhood Development Action Network, or ECDAN.
Hi, everyone. I'm Sabine. I'm from the World Health Organization in Geneva.
And we're here to talk to you about the Global Parenting Initiative.
No, Shakufi got it wrong. We're talking about the Global Initiative to Support Parents and how GPI is working with the Global Initiative to Support Parents. Why don't you tell people a little bit more about the Global Initiative to Support Parents and where it originated from?
Thanks, Sabine, for always correcting me. So the Global Initiative to Support Parents is a consortium that was established. It really came out of COVID-19 when we all came together to support parents where there were no support services there to support parents. And as a result of that, the Global Initiative to Support Parents was born. It has 5 founding members: WHO, UNICEF, ECDAN, the Global Partnership to End Violence Against Children, and Parenting for Lifelong Health and Oxford University. And we realized that we don't have a common global platform where people who work on parenting across the life course beyond sectors can come together and really make a strong case, for parenting support. So there are 4 action pillars that we work on. One is on evidence and knowledge generation and learning exchange. The other is on advocacy and coordinating advocacy together so we can increase the fiscal space in support of parenting. And 3 is around innovation, which GPI is all about. And finally, 4, none of that would matter if it's not in service of scaling up coordinated, coherent parenting support across the life course in countries. So Sabine, given this broad agenda of the Global Initiative to Support Parents, how does GPI sort of fit into that and contribute to that?
So we actually think that the Global Parenting Initiative will really help GISP achieve its objectives, especially in 2 pillars, the innovation pillar and the evidence generation pillar. Why? Because the GPI is scaling up parenting interventions through in-person, through digital, and through hybrid interventions. And working with the governments, with NGOs, and with universities to scale up, and the private sector, to scale this up. So we really think that the Global Initiative to Support Parents will be able to learn from what's going on. They're working in 6 countries, in Malaysia, the Philippines, South Africa, Tanzania, Thailand, and Uganda. And once we can start learning from what's going on in these countries in the global south, we really hope that we can scale this up, not only within the country, but then within regions and really across the world to 195 countries. So the Global Parenting Initiative is a key component of the Global Initiative to Support Parents.
This is true. So we're really, really excited to partner with you. And I think the key message here is the importance of partnership and bringing together stakeholders at all levels of the system, but across sectors. And without partnership, we're not going to be able to achieve the promise and the potential of parenting. So we're really, really excited to learn from this journey that GPI is on. And we wish you nothing but the best.
Yeah, we continue to look forward to working with GPI. We've been doing so for 3 years. We will continue to engage members at global level, at regional level, at country level. But the Global Parenting Initiative is such a key cornerstone for the Global Initiatives to Support Parents. And so we really look forward to continue working hand in hand with you. We wish you all the very best in the upcoming months and years to come. And thank you for everything that you're doing for parents and children around the world.
Bye, everyone.
Bye-bye.
Wasn't that just absolutely fantastic? And I'm not just talking about the content, but the delivery style. Massive thanks to our fabulous partners, Sabine and Shekufe, for the wonderful remarks. It is now time for the Q&A session, and we will begin with the questions that are already in the chat. And let's see. If you have questions, please use the Q&A option. Do we have any questions?
We have been diligently answering as many of the questions as we can
really?
throughout the time. So you can look through the answered questions to see some of these really great questions looking at different ways of reaching different types of caregivers, including those who take care of other parents' children or other family members, from Liz in Tanzania, and then also questions around the local languages. But maybe we could include some more questions.
Okay, I see here. Great. Okay, I can see a question here from Margaret G here. How can we apply this with incarcerated parents and especially the ARPs? I work with this population. Thank you. And I can also see that David is typing an answer.
Well, maybe I could just jump in, and think that
yes,
so there's some evidence of effectiveness of parenting programs for mothers who are in the transition out of incarceration. It is a challenging population to deliver a program for, but something that could be possible. We're not focusing on this, but we have some areas are looking at the children who are in conflict with the law. But I don't know if any of our other panelists have anything else to add to this question.
I guess I would just add that this is, oh, hi everyone, I'm Lucy. This is clearly a really important group. And if this is something that you would like to start doing research on and promoting the evidence base for, then we're really happy to help you in any way we can. And all our stuff is open source, and all our research methods are open source. So, you know, come join the group, because we want to help every parent everywhere.
Perfect. Thank you, Lucy. And I can see we have answered 18 questions. There's one right here. Our presentation is going to be shared. For those who may not see, yes, there'll be access to the recording of the launch, and we may make the slides available in a PDF format. Okay, let's answer. Okay, what have you learned from your early experiences partnering with the private sector? Jamie, would you like to answer that?
Actually, I think Laura might be better suited to answer this if you're still around, Laura.
Absolutely agree. Laura, are you there?
Yeah, I am happy to.
Great.
Could you please repeat the question for clarity for me?
Sure. What have you learned from your early experiences partnering with the private sector?
Oh my gosh, so much. It's been such a fruitful year in that regard. Specifically, one example that comes to mind is working with our partners at the Human Safety Net and at Generali Insurance on that social insurance example that I shared in the Generate presentation. And I think what's been really informative is working with high caliber teams from those places and really how far a partnership can take you in particular. But having great partners like that allowed us to think about concepts like what's kind of the regulatory environment for insurance? What's a private sector corporation's priorities? What's specific to their industry? And where are the kind of shared value opportunities to really make sure that parents get the support they need? Because in the private sector, there are industries really thinking about that as well. And our work really has something to offer to that. So those are my high level sort of reflections. And I think probably across the board, like we would agree across our different, our theme areas, it's not surprising that great partners is really the key to everything.
Thank you, Laura. And I see here a question from, my name is Khadija Khan, and I'm representing Pakistan Alliance for Early Childhood. Perfect. What is the name of your partner organization in Pakistan? I'm quite happy to answer that. So we are partnering with a number of local organizations, NGOs in Pakistan. The names that readily come to mind: Sindh Rural SRS Support Organization. We also have Kayam Relief Trust, but of course we'll also be excited to partner with Pakistan Alliance for Early Childhood. Can I suggest that you please send an email and we could discuss further after this call, if that's okay with you. And I'm also happy to share the names of other organizations. These are the ones that readily come to mind at the moment. In my experience with parental engagement and empowerment for sustainability and scale, we need to bring on board schools, since these are the voices of authority in communities. Has this been your experience as well?
I can start that answer. So We've had a lot of success in collaboration with schools. Our early testing of the programs for parents and adolescents were done in coordination with rural and semi-rural schools in South Africa, in the Eastern Cape. And the rollout of the in-person program of the Parenting for Lifelong Health for parents and adolescents in Tanzania was done in coordination with the education system. And one of our key GPI studies is also nested within rural education preschools in Malaysia, targeting, supporting with teachers delivering the interventions and supporting children ages 4 to 5. So we really see that kind of schools are both a source of being able to engage parents, but also a way of delivering programs and are central parts of the community, just like faith-based organizations, health clinics, and other points of contact that parents and families interact with.
Thank you, Jamie. Actually, I'd like to go back to Khadija Khan's comment and question. And I see that Lucy has put in, thank you, Lucy, for that. I was actually talking about the local NGOs, but we have a fantastic, really lovely colleague, Dr. Sobia Masood, who's at Azam University in Islamabad. So we are partnering, we're partnering with Dr. Sobia Masood. And I think Sobia may be on the call. Sobia, if you are, I think she may be on the call. I'm not too sure, but yes, that's our partner. I was actually referring to local NGOs earlier. Any plans to expand the scope to the Latin American and Caribbean region? Actually, we are actually working there. Jamie, would you like to comment on that, please?
Sure, thanks, Sisang. So we have some exciting opportunities for collaboration in the Latin America and Caribbean area. We've been working with the parent text chatbot with UNICEF in Jamaica, where we piloted the chatbot with 1,000 people this year. And we also have possibilities of collaboration within the Mexican government and UNICEF for working with adolescents, focusing on adolescent mental health and parents through the chatbot and in-person delivery. We also have potential collaborations with colleagues in Brazil with the conditional cash transfer system and in Colombia. So the Latin America region is really going to be an exciting space to build from our learnings from Asia and from Africa. Thanks.
Thank you, Jamie. And there's a question here from Melanie Swan at Plan International. Could you tell us a bit more about the men's engagement aspect of your work and PLH? I can see that there has been a learning group set up for this. I think maybe that this wasn't an initial focus of PLH. So what you're doing is in this area would be of great interest. I'm going to invite Dr. Godfrey Sear. Godfrey, are you there to respond to that, please? Godfrey, would you like me to read the question again?
Yes, please do read the question again.
Sure. Could you tell us a bit more about the men's engagement aspect of your work and PLH?
Okay, so thank you. That's a very important question. And I think there's not much time to answer it, but just to say that within the GPI, there are specific studies that have components of male engagement. So we shall do quite a lot of learning. But also we are drawing from existing studies such as the Parenting for Respectability here in Uganda, which is currently being scaled up within the country and within the region. And we draw from such experiences. Most importantly, we've put together a group, so a learning component that draws from within the expertise that are shared by the members of the GPI, but also we've expanded this to other collaborations, such as we're linking up now with Promundo or Equimindo now, and other groups that, would like to bring together a shared learning and experiences. So it's quite exciting, and the team is looking forward to a great engagement and learning on this. Thank you.
Absolutely true. Thank you, Godfrey. And the next question is from Jess Littman. How will GPI integrate with other existing research networks? Fantastic question. I am with the research program on children and adversity at Boston College. We have engaged with GPI and GISP in the past, and I'm interested in how we can keep working together and with other related research networks now that GPI has officially launched. Jamie, over to you.
This is a really exciting aspect of the Global Parenting Initiative, and we learned so much from other partners, and we want to respond with returning the favor when we can provide some learning also from the initiative. Every month, the Global Parenting Initiative has these research in progress sessions, and they're led by Inga Valens, and they have been really an opportunity for external people to learn, but it also has opened the doors for collaboration and other learning across other networks. And we hope to include those with our newly recruited community practice officer and throughout other learning opportunities. And so we have an open source approach, but also an open door approach to sharing across networks, and we're excited for that.
Thank you, Jamie. I see here a question from Susie at Clowns Without Borders, South Africa. Has there been any thoughts on making the app version accessible to those who are visually impaired? There was a visually challenged parent who had interest in the program based on the reviews. Sorry, I'm not sure. Based on the reviews. David, would you like to answer that?
Yes, this is something where, as well as visually impaired, of course, there's the literacy issues. And so these are things which we're very conscious of, and we definitely are wanting to work towards. There's a number of challenges, of course, to really think about how to make this accessible and really work well. But it's something we're very conscious of. And as the evidence for the app is sort of developed, that will be one of the things we'll be trying to build in as we get it out to sort of production level deployment.
Thank you, David. I think the next question is still directed at you. Are all the program beneficiaries technology savvy? Asking about the mobile apps. Do they all have access to phones, or the phones are provided?
So, and Lucy can, of course, speak to this as well, but even in the initial piloting we've been doing in Tanzania, this has been a really interesting learning curve in so many different ways, that even people who have phones don't necessarily have the sort of experience using their phones to be able to access this. And so there's even elements of digital literacy, which we've been building into some of the programs as we go along. And so this is something which is, again, it's a learning curve in a number of different ways, but there is certainly increasing access to devices, and the literacy that comes with it is really coming through the younger generation. I mean, we keep hearing about parents relying on their teens to access the parenting app to help them parent their teens, which is a wonderful contradiction and issue to deal with.
Thank you, David. I think we can take just one more question. Could involving teachers who are used to using corporal punishment actually have the effect of reducing their use of violent discipline in the classroom? When designing and rolling out a different kind of parenting support program delivered by CHWs, our team found it necessary to start with training and supporting the CHWs first to ensure negative mores and practices amongst them were effectively overcome before they started to deliver services. Would any of the panelists like to answer that, please? Or Lucy, is Lucy there?
I think this could be something that maybe Jen or Amelie could answer if they're available.
Sure, I think I just put a short answer in the chat, but I thought that was a great point that Fiona raised, that engaging with and supporting teachers first to ideally change their disciplinary techniques in the classroom would be an important prerequisite before you work with them to deliver positive parenting programs to parents in the community. So just having a first step approach would be really critical. So thank you for making that point, Fiona.
Thank you, Amelie. That's all the questions that we have time for today. And apologies if we have not been able to answer your question. Kindly share it through an email and we will respond to any questions you have. As we bring today's event to a close, I want to once again thank you all for participating in the launch of the GPI. I hope you all enjoyed the sessions and were enriched by the different talks and presentations. As you probably realized from the different presentations, there's much going on at the GPI. Our vision is quite ambitious, but we are confident that with your support, the GPI will fulfill its aim of enabling all parents to get the support they need to the level that they need the support. Before we leave, we'd like to highlight some of the great work that our team members are doing. Dr. Jamie Lackman has won a Star Humanitarian Award from the Star Scholars Network for work that has had a profound global equity-oriented impact with work which is fundamental to equity and scholarship. Professor Kathy Ward has won the 2022 IAC-APAP International Contribution Award, which recognizes the accomplishments of a senior individual who has made outstanding contributions to child and adolescent mental health and underscores the contributions of the individual to services development, research, and teaching in low or middle income countries. Congratulations to both Jamie and Kathy. I wish there was, and I wish we had this, we could toast to them or something, but unfortunately that's not possible in a Zoom call or in the webinar, but congratulations. We're also proud of you all. If you'd like to learn more about the GPI, be sure to visit us online at our new website and keep in touch with us via our newsletter, email, or social media, all of which can be found in the chat or the program. Here's wishing you all happy holidays and the very best of the season. I'm glad to see that we still have 2 minutes left. Stay well, stay safe. We look forward to meeting again and working together in 2023 and beyond to make the world a better place, a safer place, and a more playful space for children and families. Thank you and goodbye for now.